Hi, what's your name?
Sam Tucker.
What sport do you play, Sam?
I am on the club basketball team here at SDSU.
I see we're here to follow up on this right thigh.
Yes, I got hurt last night at practice, and I thought I would just follow up with you today just to see if I'm okay.
Before we get into the current injury at the thigh, can you tell me any previous injuries you've had?
I think it was June 2019. I dislocated my pinky at the PIP joint in my right hand. Then in January 2020, I actually dislocated my left shoulder.
Got it. Can you walk me through what happened when you hurt your thigh this time?
Okay. I jumped up to get a rebound, and I felt a pull in the back of my thigh when I was jumping up.
So MOI, jumping up. Can you point with one finger where the pain begins?
Yeah, it's kind of back here, in the back of my thigh, kind of towards the outside of the back of my thigh, if that makes sense.
Got it. So what brings you in today? I know you felt a pull when you jumped up, but what is currently bothering you?
I have some pain behind my thigh during some long strides, and sometimes I feel it nagging a bit when I try to jump. It is all tolerable, but I thought it would be best to come see before I head out to practice just to be sure.
Okay, what type of pain would you describe it as?
It feels, I guess, a little bit achy, but tolerable.
Now, on a scale of 1 to 10, 1 being basically no pain and 10 being unbelievable pain, what would you give the current pain you're experiencing in your right thigh?
It's like, I would say a 2 out of 10.
Did you do anything for it between yesterday and now?
I raced it once after practice before seeing you today.
Does the injury prevent you from doing any of your daily tasks?
No, like I said, it's only when I stretch out the back of my thigh do I feel something, but it is tolerable.
Okay. So I see when you walked in that your static posture and gait were within normal limits. There were no deviations. Can you please go ahead and sit on the table with your feet over here so I can see if there's any effusion or edema in your knee? And this is your right side, correct?
Yes.
So no effusion or edema in the right knee. So there's no asymmetry to be noted. Now let's get into the testing. If you can, please go ahead and flip on your stomach. So first I'm going to do active range of motion. I'm going to do active range of motion for knee flexion. So can I please have you bring your right heel to your right butt cheek, please? Go ahead and relax. Is there any pain with that?
No.
So it has full range of motion and there's no pain for knee flexion. Now since we're here, let's go ahead and continue with the flexion. Because there was no pain and there was full range of motion, for active range of motion, we do not need to perform passive range of motion, so we'll skip right into mid-range of motion. So if you can, please go ahead and bring your heel to your butt there, and I'm gonna bring your leg down towards the table. I want you to maintain this position, all right?
Okay.
So go ahead and hold it there for me, please. Good, and relax. Go ahead and put your leg down. So mid-range of motion, knee flexion. Is there any pain?
Yes.
So there's some pain when holding mid-range of motion for knee flexion, but it is still strong. Got it. So now let's go and do knee extension. Can you come sit at the end of the table for me, please? So what I'm going to test first is active range of motion for knee extension. So with your right leg here, can you go ahead and bring your leg out straight for me? Great, go ahead and relax. Is there pain with that?
Yes.
Yes, so it has full range of motion for knee extension, but there is pain. Now I'm going to check passive range of motion knee extension since there was pain with active. So if you can relax, I'm going to passively extend the knee for you. Relax. Is there any pain with that?
No.
So the athlete does have full range of motion, and there's no pain with passive knee extension. Now let's do mid-range of motion for knee extension. So if you can bring your leg up towards my hand here for me, please. And hold it there. Don't let me push you down. Good, relax. Is there any pain with that?
No.
Perfect. No pain, and it is strong. So I see we're going to need to look more at the muscles in the back of your leg. So if you can go ahead and flip back over on your stomach for me, please. Now I'm going to do specific manual muscle testing. I'm going to test the muscles that deal with knee flexion. So the biceps femoris, semitendinosus, and semimembranosus. So let's first test the biceps femoris. So on the right leg, I'm going to put this here. Right leg here, I am going to bring the heel up. I'm going to bring the lower leg towards the midline and point the toes towards the lateral side, testing the biceps femoris here. What I want you to do is don't let me bring your leg down to the table, all right?
Okay.
Hold it in that position for me, please. Hold, hold, hold. Good, and relax. Perfect. So that was, the grading would be hold against gravity with moderate resistance there. Then what we're gonna do is we're gonna test the semitendinosus and semimembranosus. We're gonna go ahead and get in the same knee flex position. Now the lower leg's going to the lateral side, the toes are facing towards the midline. Same thing for me here. I'm gonna try to bring your leg down to the table, hold it there and don't let me move you. Good, relax, perfect. So with that, just hold against gravity and full resistance there for the semitendinosus and semimembranosus. So what I want to do is I want to rule out some of the other structures in the knee just in case. So if you can, please go ahead and flip on your back for me now. So I'm going to first test the anterior talofibular ligament. I'm going to put this on your leg right now. I'm going to do that by performing the anterior drawer test. Here for the anterior drawer test, there's no excessive anterior translation of the tibia on the injured side. In that position, we are also going to test the posterior cruciate ligament by doing the posterior drawer test, pushing the tibia posteriorly. Now for the posterior drawer test, there's no excessive posterior translation on the injured side. We're also going to check the collateral ligaments. Let's begin by testing the medial collateral ligament by placing my hand on the lateral side and trying to gap the medial aspect of the knee. Note there's no medial joint gapping felt on that medial side. I'm now going to do the varus stress test. Same test, but from the inside. Trying to see if the lateral side will gap. No gapping is found on the lateral side. So the anterior cruciate ligament, posterior cruciate ligament, medial collateral ligament, and the lateral collateral ligament doesn't seem to be the issue. We are going to, just in case, check the meniscus a bit by doing the McMurray's test. No catching, no clicking, no pain felt at the joint line while twisting there. After special tests, we would go into neurological. For this video, we're not going to perform the neurological test, but please note that both dermatomes and myotomes would both be negative in this situation. So for neurological, I would put within normal limits. After neurological, I would then go into palpation. So from my findings so far, I can conclude that the biceps femoris is the muscle that's causing a little bit of nagging. So either while in this this supine position or on our stomach in the prone position, I am going to palpate along the biceps femoris. And then ask her, is there any tenderness along that muscle?
No.
No. So for palpation, I'm going to put none. If you can please sit up and come to the end of the table and we'll talk about the assessment here. So from our findings here, you possibly have a right grade 1 biceps femoris strain. The plan here is to continue as tolerated since it's only nagging you just a little bit. So your participation status is full. There's no limits on what you can do, but if there's anything that comes up, feel free to come talk to me. We'll reevaluate. All right?
Thanks.